Connecticut Eye Consultants, we never stop pursuing perfection. As a cataract center of excellence, we offer patients the most advanced diagnostics and surgical techniques available today, and we have been for decades right here in Connecticut. We're innovators in lasers and lens implant technology and are dedicated to helping our patients enjoy a lifetime of the best possible vision. This educational video has been prepared for patients visiting our prospect office who may be considering cataract surgery. Our goal today is to help you enjoy a lifetime of the best possible vision by assisting you in making a more informed and educated decision regarding your cataract choices. Because you will undergo bilateral cataract surgery only once in your life, it is important that you understand the importance of today's visit and the exciting new options you have as a cataract patient.
This is a really exciting time to be a cataract surgeon. When you talk about what I can offer to a patient today versus 15 years ago, I mean, it's no comparison. There are newer technologies that are coming out every year. As far as patient outcomes, I would say the best people to ask about that are honestly the patients. I can tell you that in the right situation, with the right anatomy and the right testing, I can fairly frequently get a patient out of glasses entirely using laser surgery or an advanced technology lens.
It's an exciting time to have cataract surgery. 10 to 15 years ago, everyone got the same implant. We didn't have choices. Today, patients have choices as to which implants go into their eyes. The implants are permanent. We never go back and change them. And so it's important that patients understand their options. We educate our patients about their different options. That's an option for their eye. Cataract surgery is exciting because many patients have worn glasses their whole life, and this is their first time at freedom from glasses. The most common cause of falling are actually bifocals or progressive eyeglasses. And so depending upon the implant that patients choose at the time of cataract surgery, they can decrease their dependence on reading glasses or on bifocals or progressives.
My vision was very blurry. I couldn't read anything on TV. When I went shopping, I didn't really enjoy going shopping because I couldn't read the signs on the aisles in the grocery store, for instance. So I knew something was going on. I needed to do something. When I met Dr. Johar, I was very impressed with her. She's a loving, caring person, and she understands how your eyes are so important to you. And she's there for you. Any question you ask, she's happy to answer. All my life I was nearsighted, so I could never see far. So I needed glasses for seeing. And then, when you get older, you also need them for close. So in between time, I did wear contacts, which was fine for a while. But then when I needed them for close, I said, well, I have to go back to glasses again. So I never thought I'd be able to, live my life without glasses. When Dr. Johar told me that I could see without glasses, I was ecstatic because I talked to a few friends and they said, oh no, you're going to need glasses when you're done. And I said, well, that's not what I was told. The doctor I went to said that there was a possibility I wouldn't need glasses anymore. So that was exciting to me. The lens that I have is multifocal, and it's amazing because you could see far and intermediate and also reading. And it's just like, having perfect eyes. It's nice, really nice. My vision is just as good as if, I never had glasses before. Yeah, when I was younger, I had no choice, but now I see without glasses perfectly. Most of the people that had cataract surgery that I know of, they are still having to wear glasses. So they were saying, I had somebody tell me, oh no, you're going to need glasses. You will. You'll still need glasses after the surgery. And I said, oh, that's not what my doctor said to me. So, and now they see it. They see me walking around without glasses and they go, wow, she isn't wearing glasses, is she?
Life is a collection of amazing moments. Moments we spend with those we love most. Moments that capture the essence of our lives. Moments we will never forget. At Connecticut Eye Consultants, our passion is to ensure you don't miss a single moment in life. That's why for more than 30 years, patients across Connecticut have chosen us to restore their vision through customized cataract surgery. We believe your amazing moments deserve amazing vision. Call us today for your cataract evaluation.
Astigmatism is when the cornea is unevenly curved. Usually the eye is round like a baseball, but with astigmatism, it is more oval-shaped like a football. Light passing through this unevenly shaped cornea is not properly focused on the retina. Distance and close vision may both appear blurry.
At Connecticut Eye Consultants, we specialize in the treatment of astigmatism, which can be corrected in a number of proven methods. These include toric lens implant correction of astigmatism, surgical correction of astigmatism with limbal relaxing incisions or LRI, laser-assisted cataract surgery. Our eye care professionals are specially trained to diagnose your level of astigmatism using the latest breakthroughs in diagnostics to select and utilize the safest and most effective treatment method for your eyes.
Presently, in the right patient with the right testing and the right counseling, you can take care of their cataract, which is a removal, and then you can replace the lens with a lens that will take care of the astigmatism and potentially give them good vision at distance and intermediate, maybe even at near. It's all about understanding what you're expecting going in, and that's what the cataract consultation process is about. A patient who loves to ski is very different than a patient who loves to build model airplanes. And so when I meet you for a cataract consultation, I always say like the same kind of basic series of questions. Tell me about you. Tell me about what you do. What do you do for work? And then what do you do for fun? There's no reason to fix your distance vision for shooting targets if you've never held a gun. You know? And so my patients that play golf want something different than my patients that ride bikes. It's not a one-size-fits-all approach. It's actually custom cataract surgery at this point.
Many patients today have astigmatism. They may not be aware of it, but it's corrected in their glasses or their contact lenses. At the time of cataract surgery, we can permanently correct this astigmatism with toric implants. Toric implants are fabulous because they give you a clarity of vision that can't be achieved even in eyeglasses. If astigmatism is not corrected at the time of cataract surgery, you're going to be dependent upon eyeglasses or contact lenses for the rest of your life to correct that astigmatism in your eye.
When I got my first pair of glasses as a sophomore in high school, I thought, well, this is going to be my cross to bear. I'm cursed till the day I leave this earth wearing glasses. And that actually, because of Dr. Johar, ended up being not true, that I'm glass-free today. The way Dr. Johar went over step by step, and there are 4 or 5 different lenses that you can choose from. And she went through each one, in my particular case, what they would do and how they would better my vision. And the multifocals were the ones that would free me from wearing glasses. So that's why I chose the multifocal lenses. I read the newspaper every morning, and I don't wear glasses to read the newspaper anymore, or to watch television or anything. I don't have to wear them anymore. And I can wear stylish sunglasses now. Cataract surgery is definitely an investment in a life investment, a quality of life investment. Why not, we'll say, treat yourself to good vision, better vision, better vision than I've ever had in my life. Like I said, I wore glasses for over 40 years. No more glasses. Well, I mean, I think I'm worth at least that, to have perfect vision. As far as cataract surgery goes, the only regret that I have is that, believe it or not, is that I didn't get them years ago and be able to have had the surgery done and have gotten rid of my glasses years ago.
For the latest breakthroughs in cataract care, look to the pioneering surgeons of Connecticut Eye Consultants. With our breakthrough laser and lens implant technology, we're not only helping restore your vision after cataract surgery, we're helping renew lives, giving you the freedom to enjoy life as it was meant to be seen, freely and clearly. Call Connecticut Eye Consultants today at 203-791-2020 for a brighter, clearer tomorrow. Connecticut Eye Consultants, advancing the art of cataract care.
Hi, I'm Barbara, and we are in my home just outside of Salt Lake City in South Jordan, Utah. We love the mountains. My husband and I have been married for 49 years, and we have 6 children, and right now 19 grandchildren. I'm very active. I like to hike. I go to the gym every morning. I've always loved to garden, to work out in the dirt and to grow, and I love being able to plant a seed and watch it grow into something that's really magnificent. I have done art my whole life, actually. I have focused on portrait work, and I love it. I've done commissioned work for different people, and I've done my own children and grandchildren, and it was my art that sent me to try to find a solution. I was extremely frustrated in how my eyes had become. Actually, I've worn glasses since I was in 3rd grade, so I've never had good eyes. You know, I couldn't see from a distance, and I couldn't see up close, and I couldn't see in the middle. But then, as I got the cataracts, the colors were fading, and I was just really frustrated with my eyes. Yeah, I quit driving at night because I didn't want to hurt myself. I didn't want to hurt anyone else. I was fearful that I would go blind, to be honest. Finally, I called up the local institute here and asked them, is there anything you can do for me? And they told me about this PanOptix lens. And as they were talking to me, the hope just flooded over me, and I thought, there is a chance I am going to get this back. And I did not have 1 minute of hesitation. The doctor was absolutely wonderful, and he said that it could be back to normal eyesight. And I've never had normal eyesight. I have never been able to see without help. My vision after this surgery, I really had high hopes. Well, the first time that I walked in and for him to check me, he asked, how are you? And I said, I am fantastic. And he said, yes, you are. They said that I was 20/20 vision distance, 20/20 every single distance that they tested. I was just thrilled. I couldn't quit thinking about it. You know, I would walk around and look at this and look at that. I don't ever wear glasses at all. I drive anytime I want to now. I'm just so happy to be free. I've decided to start doing piano. Well, basically just because I could now. I don't have to be hunting for that sweet spot with glasses and tipping my head up and looking down. I don't have any sweet spots anywhere. It's all sweet. For reading, for my phone, for sewing, for threading a needle, for painting. Colors are more vibrant. It's vital to me in what I do. It has absolutely been a life-altering for me to have these eyes, and it also was a big change because I felt so much hope. This is a painting that I did after my eye surgery was done that depicts how I felt and my attitude. I called the painting Undaunted. Undaunted means can't be stopped and is full of hope. I had an instructor come up to me from my kickboxing instructor and give me a high five, and she said, I want to be like you when I grow up. I am never going to quit either. Because I just have this overpowering feeling of gratitude that this is a blessing to me, and I'm so thankful for it. I just love it. So here I am, 70 years old, and I have new eyes. My name is Barbara, and I am a panoptimist.
We now offer multiple lens options that are custom designed to fit your lifestyle, which include lenses to treat your astigmatism and lenses that allow you to see at near, intermediate, and distance with little or no dependence on prescription eyewear.
I think we have to reframe the discussion about cataract surgery. This is not the cataract surgery that you think of from the 1970s. This is an opportunity in a lot of ways to improve your quality of life, perhaps give you back some things that you haven't had in a long time. We can make your vision for driving at night better and potentially even improve the quality of your vision in day-to-day things. There are so many options for patients at the time of cataract surgery now that a bigger and bigger part of what I do is work through those options with them. I'm only going to do this cataract surgery once. In the best case scenario, it's a one operation and that lens is going to last for the rest of your life. Let's take a couple more minutes. Let's talk about what we have to offer. I want you to think about it because this is a rest of your life decision. Let's make the right one.
Part of my goal as a surgeon is to make sure my patients understand their options for cataract surgery. The implants are permanent, they can't go back and be changed, so the decision that you make is one for a lifetime. It's a 10-minute surgery for me, but that decision affects you for the rest of your life. So many patients don't know that they have options to correct their vision at the time of cataract surgery. They are pleasantly excited when we educate them about their different options. I specialize in custom cataract surgery, which means we do testing to learn the shape of your eye, and I also want to know you as a person. You know, what do you enjoy? For example, do you enjoy golf on the weekends and then you're working on the computer during the weekdays? We can find an implant that can help you do both of them without correction. Patients today do not stop their life at retirement, for example. You know, like maybe our grandparents or great-grandparents. They don't stop their life when it gets dark. They want to live a full range of life at all ages. And so our implants have to keep up with their visual demands. They want to be able to drive to Florida or play golf, and they want to be able to read their books on the Kindle or FaceTime with their grandchildren. They want a fuller life. Results today from cataract surgery are more precise than they ever have been in the history of cataract surgery. And that's because our technology at the time of your preoperative testing has gotten much better. And so we know the difference between eyes from patient to patient and between your right and your left eye. So we can customize the implant to match your eye's shape.
Connecticut Eye Consultants are proud to once again set the standard in cataract care with the introduction of the PanOptix trifocal lens implant. This game-changing lens implant is designed to help you enjoy clear vision at all ranges, including near, intermediate, and distance. You can also combine PanOptix with the added benefits of our laser cataract surgery technology. Learn more by calling 203-791-2020.
Before cataract surgery, I noticed while we were especially driving on the highway, I couldn't see the signs as good, and we travel a lot, so that wasn't good. So I knew they were getting worse, and went to my doctor, and she said, yes, you definitely are ready. I was expecting to at least be able to see distance, but everybody told me for a close-up you're going to still need glasses, you're still going to need, reading glasses. The prognosis was that you're going to be able to see without glasses after all those years. And so far I haven't had them, which is what Dr. Johar said. To this day I still look for them. In the morning I go to put them on. After 61 years of putting glasses on every morning, I still go for them. But just to be able to see without them, wake up in the morning and be able to see is great. Today my life has changed. It's like I can wear sunglasses. The only sunglasses I ever had were the ones that change, the regular prescription one. So I've never been able to. So far I've gone out and bought 4 different pairs of sunglasses, a white pair, a black pair, silver, because now I can wear them. So it's amazing. When she first mentioned the different lenses and all, and then I said to myself, well, at this age maybe I shouldn't spend the money, extra, get the lower cost ones. But then I said, you know what? This is your eyes. There's only one in a lifetime you're going to do it, and something for me finally, and I really did it, and I'm so happy I did it. There's no way you can ever put a price on what I have now. nothing, no way at all. I mean, just to be able to see everything. I read, I love to read, so I'm reading very well. For working with my hands up here, close up and distance, and now to be able to do all of it without wearing glasses is amazing. If people ask, I just tell them, if you need it, go to Dr. Johar and get it done. It's really, really that easy. I mean, it is simple. It really is. It doesn't sound like it is, surgery on your eyes, but it really, really is.
All of the cataract lens packages you will learn about today in this video or from your surgeon are approved by Medicare, but not covered by Medicare. The same is true of our laser cataract surgery technology. Fortunately, Medicare and the insurance industry now allows you to upgrade your vision during cataract surgery with these new and improved cataract lenses and surgical techniques, including laser cataract surgery.
Broadly speaking, there are two ways that we do cataract surgery in the United States now. There's the traditional way, which is with a blade, and then there's femtosecond laser-assisted cataract surgery. Not everybody has access to both, not everybody does both. I do. Laser cataract surgery is the newest thing on the market. What it is indicated for is for centration of a premium lens and for astigmatic correction at the corneal plane. What the laser does is it will make my incisions for me, and it makes them perfect. It's like watching a Swiss clock just run. What it does as far as the patient experiences is that there's less inflammation because I have to use less energy from the ultrasound. And it's different. I've had patients that have had both, not many, but a few. And they tend to say the laser is better in some ways. What's better about it? Well, they feel like they got the best that's out there. And I understand that. If you have particularly bad anatomy as far as the support system for your natural lens, if you want a premium lens or an advanced technology lens perfectly centered, I think it's a reasonable discussion to have. And if you have astigmatism that does not meet the threshold for correction with a toric lens, it's a slam dunk.
I want patients to know that it's an exciting time to have cataract surgery at Connecticut Eye Consultants because of all the advanced diagnostics that we have, the lasers. It's a safe procedure, and most of our patients will tell us that they wish they had it earlier.
Congratulations! Your journey to a cataract-free life has just begun. The first step is to understand a bit more about cataracts and the options for treatment. Cataracts are common, natural, and develop with age. They impact your normal clear lens with clouding, causing your vision to become blurry or less colorful. There are 3 basic steps to cataract surgery: access, removal, and replacement. Understanding these steps can help you think through your procedure options. There are 2 options: a manual procedure or Catalyst Precision Laser System. First, when you think about shape, a manual procedure can create an irregular lens edge, while the Catalyst system delivers a nearly perfectly round shape. Next, you should think about size. In any cataract procedure, lens segments are removed through a tiny incision using a separate machine called a phacoemulsification system. With the Catalyst system, the lens is pre-segmented for easier separation, while in the manual procedure, the lens must be removed without pre-segmentation. Finally, when considering the 2 options, you should think about placement. In a manual procedure, the IOL alignment is approximate, while it is more precise with the Catalyst system. Talk to your doctor about the laser difference. It's personalized, precise, simple, gentle, and proven. Talk to your doctor and make sure your experience is right for you. And live the life you want to see.
Here's great news for people considering cataract surgery. The leading cataract specialists at Connecticut Eye Consultants are now performing an advanced new method of cataract surgery designed to reduce patient fear and anxiety and increase safety, precision, and accuracy. It's called laser cataract surgery, and if you're considering cataract surgery this fall, call Connecticut Eye Consultants today at 203-791-2020 to see if you're a candidate for laser cataract surgery.
So in boating, obviously, eyesight and distant sight is really important, but also near vision. The water around here is deceiving. It's all at the same level at the top, but the bottom changes rapidly in some cases from being, 20 feet deep to suddenly it's 1 foot. So you better be able to read that depth finder. My name's Bill. I'm 73. I'm a father of 4. We're on a place called Folly Beach in South Carolina. It's a beach town for Charleston. We can be downtown in 15 minutes. It's really pretty. It's kind of a visual feast. You turn a corner and you discover something new. I'm a commercial licensed pilot. I'm not very active as a pilot anymore. If I fly, it's usually as a co-pilot, not as pilot in command. I'm also a columnist for my own magazine and a columnist for Aviation Week. So I do some writing, but my main function is to serve as editor. Yeah, vision's kind of important for an editor. I'm on the computer all the time. I get a lot of hard copy. I read a lot of magazines. I read a lot of newspapers to try to get ideas. The nighttime driving really was a stopper. And finally, it got so bad, my wife laid down the law and she said, "You're not driving it at night anymore. We're done with that." My first surgery was December 20th, 2017. Right after the surgery, even on the way home wearing my sunglasses and what have you, I was startled to see that I could read the road signs. And honestly, I had not been able to do so. But 2 days after the surgery, I got in the car and I drove 740 miles in daylight and nighttime and really saw everything vividly. And I only had the one eye treated at that point. Now I take it for granted. Now I take for granted that I can read the signs, that I can drive at night, that things aren't jumping out at me or anything like that. The headlights on the oncoming cars blossom a little bit, but it's not startling or anything like that. It's perfectly manageable. It does provide freedom. I think the panoptic lenses free you of compromise. I have near vision, I have middle vision, and I have far vision. The only glasses I wear are sunglasses, and there are no lenses in those. I can read this copy easily from here, and I can read it actually even easier from here. And I can still read it from here, though now it's getting close. The greatest benefit to me of the surgery and the Panoptix lens is that it has given me confidence in my visual ability. I'm just very satisfied and thankful. My name is Bill, and I am a Panoptimist.
So patients come from all over the state and beyond the state, even beyond this country. Many times they have family in the area, but many times they find us on the internet through our credentials that are seen online, and they decide to come. I have some patients who come in from the Caribbean and fly in multiple times a year just to see me because they need specialized retinal care. And the care we provide here at Connecticut Eye Consultants is for everything, not just retina. It's from the front to the back of the eye, every subspecialty you can think of, at its most state-of-the-art way. So we have all the imaging technology, all the interventional medical and surgical ways to help retinal and non-retinal diseases here at Connecticut Eye. So patients really don't need to travel very far if they're local.
The best outcomes are still achieved with prevention. However, we've made big strides in the treatment, and I wouldn't use the word cure, but the treatment of macular degeneration and diabetic retinopathy. The numbers are not as rosy as we'd like them to be, but way better than what it used to be in the 80s and 90s, where there truly was no hope.
After medical school, you have to go to ophthalmology residency and vitreoretinal surgery fellowship. So it's a long road to do really a very, very minute, specialized part of the body. But the retina, though it's a small part of the body, is very important, obviously. The retina, in my opinion, is really one of the most important parts of the eye when it comes to preserving and having good vision. And the medical and surgical aspects of treating patients who have those kinds of diseases is what I found most fascinating.
Patients with macular degeneration, they can blame or thank their parents for the genes that they inherited from them. Let's face it, probably close to 80% of macular degeneration is genetically determined, and the rest is lifestyle and environmental factors, and in terms of diet and smoking. But for the most part, for the large part, it is genetic. It's a genetic disease, let's face it. It's primarily prevalent in the Caucasian population, more so than other ethnic or racial groups. And it runs in families. We call it macular degeneration because it only affects the macula being the center part of the retina. I mean, it's defined by physicians. There's truly no clear separation between the macula and the rest of the retina. So it's something that's defined by physician surgeons as the macula, which is the central part of the retina. But this is where the disease is. Contrary to diabetic eye disease, which affects the rest of the retina, as well as the macula. So diabetic eye disease is something, diabetes may be affected by genes, but after certain years or decades of diabetes, unfortunately, even in patients who are well controlled, in whom the diabetes is well controlled, we could see signs of diabetic eye disease. It's not, while we feel sometimes powerless when it comes to macular degeneration, in terms of prevention, with diabetes is quite the opposite. The best treatment for diabetic eye disease is still prevention.
Clinical research at Connecticut Eye Consultants has been performed for many years now. And by doing so, we've helped the FDA approve drugs that have helped individual patients, which has helped society as a whole. We continue to be intimately involved in many clinical research trials for aspects of the eye from front to back, including retina, which is what I do. And by doing so, it's helped many patients, helped society, and continues to do so. So not every private practice has to do research. In fact, I would say only the minority of them do. Most people have the perception that research is only done in major institutions in large cities, under universities. And though they are done there, we're happy to say that for many years now, we've been doing cutting-edge clinical research here. Personally speaking, I've been doing research since I was an undergraduate, where I had many grants accorded to me, research grants to do biochemistry research. I carried that through to medical school, where I did continue to do clinical research through residency and fellowship, and I've been doing active research from bench to clinical for 20 years now. So I find it exceedingly important to be able to offer that to patients. I've made it my mandate, as many of us here have, to include that as part of the repertoire of what we offer patients, because no doctor has all the answers now. We're actively looking for the answers to come so we can offer it to our patients sooner.
We have state-of-the-art equipment, latest technology, latest approach, wide field imaging, and in the operating room we were at the forefront. We were the first adopters and adapters of sutureless technologies, sutureless surgery with 25 gauge, 23 gauge, and soon 27 gauge. We were the first ones in the area to shift to an outpatient ambulatory surgical center almost completely for our surgical retinal cases. And on top of all that, we have a very busy research department. We certainly are at the front line of technological advancements and medical availability and knowledge, and being part of larger networks offer us the best tools to tackle the cases or the difficult cases of macular degeneration and diabetic retinopathy that we encounter in our community here. We're always looking for new ways to treat our patients, to offer them, albeit a glimmer of hope, because I do love what I'm doing, and it's truly a passion, or my passion. I always wanted to be an ophthalmologist, so I find it here at Connecticut Eye Consultants.
At Connecticut Eye Consultants, our retinal specialists are helping prevent vision loss from diabetes-related eye disease through early diagnosis and treatment. If left untreated, diabetes can cause permanent vision loss. If you have a history of diabetes in your family, or if your diabetes has been causing changes in your vision, call Connecticut Eye Consultants today for a comprehensive evaluation by one of our retinal specialists. Protect and preserve your vision. Call 203-791-2020 today.
Hi, my name is Sandy. I'm 66 years old. I live in Watertown, South Dakota. We're a town of about 22,000 friendly people. I have 3 grown children, and I have 13 grandchildren, which are the joy of my life. After I retired, I opened a gallery in downtown Watertown. My artwork, I think, is colorful, it's joyful. I like to fly by the seat of my pants and just start painting, and sometimes I don't even know what I'm going to paint. I just start putting color on and get a feel for what I'm doing, and I go with it. One of the local scenes that I've done is the Kemp Avenue Bridge, the stone bridge. It was sort of a gradual thing, so I didn't realize how bad it really was. So when I went to an optometrist and they tested my eyes, I was told that I was almost legally blind in one of my eyes for night vision. I was really surprised, and I thought, well, no wonder I don't like driving at night. I also noticed that with my artwork, when I was doing fine detail, my eyes, it was hard. It was a strain. My eyes would be blurry. It was hard to read fine print, and so I thought I needed a better prescription, and she told me that I actually had cataracts. One was pretty bad, the other one was getting there. Basically, my ophthalmologist told me that I might not have to wear glasses or contacts if I had the PanOptix lens implanted. So I had my first surgery, and I went back the next day to have my vision checked, and I already had 20/30 vision, which they said was really not usual. I couldn't have been more pleased. And so a month later, then I had my second eye, and once again, I had just a great result from it. I have not worn my glasses or my contacts once since my first surgery. My vision is so good that I just don't even, I take it for granted almost now because it's been a year. I feel more confident driving at night. At our lake cabin, I used to just wave at every boat that went by because I couldn't see who was on the boat, and everybody would wave back. But I didn't know if I really knew them or not. But now, since having my surgery, I can actually tell who most of the people are. So I can see far away like that. I can read without any difficulty, even really fine print. And my intermediate vision is good also. There is nothing that I can't do with my vision. It's been wonderful. My name is Sandy, and I am a pan optimist.
If you are scheduled to have a comprehensive eye exam or vision screening, you are taking an important step in caring for your eyes. Keeping your appointments with your ophthalmologist is a vital step in preserving healthy vision. To help you understand what to expect during your visit, let's take a look at what may happen as part of your exam. When you go into the exam room, your ophthalmologist will ask if you are having any eye or vision problems. You will be asked to describe these problems, including how long you have had them. You will review your history of glasses or contact lenses. Your ophthalmologist will then ask about your overall health, including any medications you take and your family's medical history. During the discussion, your ophthalmologist may look away to make notes on the computer to keep proper records for your visit. Despite having to look away, rest assured that your ophthalmologist is listening to you. The eye doctor will check your vision, or what we call visual acuity, using a Snellen chart. This is the chart with the random letters in rows that become smaller line by line. You will be asked to read the lines of letters until you can no longer see them. To see if you need glasses or a new glasses prescription, the ophthalmologist will place several lenses in front of your eye, one at a time. He or she will ask you when the letters on the Snellen chart become easier to see. This is called a refraction test. The chair you sit in has equipment attached to it. This is called the slit lamp microscope. This device allows the doctor to see the inside and out of your eye up close. You will rest your chin in the chin rest attached to the instrument and place your forehead against the head support. Be sure to move your whole body to the edge of the chair and as close to the slit lamp as possible. Your ophthalmologist will then shine a light into your eye and look through the magnified lens. He or she will examine the clear surface of the cornea, the white of your eye called the sclera, and the colored iris. For an eye pressure check, you will have anesthetic drops put in your eye. As you sit very close to the slit lamp, your doctor will guide an instrument very gently so that it's just touching the front of your eye. This test, called tonometry, is used to detect and monitor glaucoma when you have increased eye pressure. Your ophthalmologist will check your side or peripheral vision. You will cover one eye, and the doctor will ask you to focus on a target in front of you and describe what you see out of the corner of your eye, so to speak. He or she may use their upraised finger as a target, or you may sit at a machine that has blinking lights appearing in different places. You will be instructed to press a button whenever you see a light. If your eye doctor plans to examine the retina and the optic nerve at the back of your eye, he or she will put eye drops in your eyes to dilate or widen your pupils. It takes about 15 to 20 minutes for your eyes to dilate. Looking through the slit lamp again, your ophthalmologist will check the back of your eye. This area is called the fundus. It includes the retina and nearby blood vessels as well as the optic nerve. Your doctor may also use a handheld device called an ophthalmoscope to help closely see the structures at the back of the eye. After being dilated, your eyes will be sensitive to light for a few hours. Sunglasses will help when you go outside. There are other tests that may be performed as part of your eye exam. Your ophthalmologist will decide which tests you need based on your medical history and what he or she finds during the exam. If you have any questions about the exam, be sure to ask your ophthalmologist or a member of the eye care team. He or she will be happy to explain why certain tests are done, as well as how to care for your eyes. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
Thank you for choosing Connecticut Eye Consultants for something as important as restoring your vision. We look forward to treating you like a member of our family.
Cataract is a common eye condition affecting millions of people, usually as they get older. A cataract is when the normally clear lens inside the eye becomes cloudy. Vision becomes dim or blurry, and driving at night may be more difficult. Things may appear less bright or colorful. Normally, the eye's lens is clear, allowing light rays to pass through and focus as they should on the retina. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it cannot focus clearly on the retina, and objects look hazy or blurred. If you are bothered by dim, hazy vision from cataracts, your ophthalmologist can restore clear vision with cataract surgery. This is a very common procedure. This is when your eye surgeon removes the cloudy natural lens from the eye and replaces it with an artificial lens. During cataract surgery, your ophthalmologist will make a small opening in the side of your cornea. He or she will insert a pen-shaped instrument through the opening to reach the lens. This instrument uses a special type of energy to break up the center of the cloudy lens. Then it will carefully suction out the lens pieces. Your surgeon will then insert an artificial lens called an intraocular lens, or IOL. This IOL will stay in your eye permanently. The new lens lets light pass through and focus properly on the retina, bringing back clear vision. Once the IOL is in place, your ophthalmologist will close the incision, either with or without stitches. After surgery, a plastic shield may be placed over your eye to protect it. Surgery is the only way to remove a cataract. You do not have to have a cataract removed until it begins to affect your daily activities. Until then, changes to your eyeglass prescription may be all you need to improve your vision. Each year, millions of people find that cataract surgery improves their vision and their quality of life. If you have cataracts, discuss your vision goals with your ophthalmologist. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
So I had gone to my regular eye doctor, Dr. Pulaski in Waterbury, who had monitored my eyes because I have a history of cataracts in the family. It's hereditary. The cataracts developed in both eyes. He monitored it for a number of months. Finally, in the left eye became very blurry, and the right eye was somewhat blurry. He suggested that it's time to have something done. Dr. Johar explained that there's a number of different options for lenses, almost like buying a car. You can get option A, B, or C. And the option for the multifocal lenses was one that afforded vision distance, intermediate, and near vision. And because of my age and because of my profession, I do a lot of reading, I do a lot of computer work, I do a lot of research, and I wanted to have that option that I wouldn't have to wear glasses, I wouldn't have to wear contacts, and so I decided to go with the multifocal lenses. The surgery itself may have lasted 15 to 20 minutes, done, and I was out in the recovery room longer than I was actually in the surgery. So I was not fazed by it at all. And then when I had the second eye done a month later, same thing. It was very easy, positive experience. Nothing to be afraid of. So the outcome that I was looking for, I wanted to, number one, improve my vision from what it was because it was very poor. Dr. Johar did say that I might achieve 20/20 vision, but there was also the possibility that I might need to use reading glasses or other glasses for computer work. And it turned out that following the surgery, I've got 20/20 vision. I can see perfectly clear all distances. I don't need any glasses for the computer work or reading, which is wonderful. I have no issues driving at night, no problems athletics, work is fine, so it's all a positive. I haven't seen this well in about 40 years, so I've been wearing either contacts or glasses for that long of a time period, not having to use any of that anymore. It's just a great experience.